There's always talk about finasteride sort of guarding you against shock loss because it keeps your hair in that growth phase for a much longer period of time. And that's often been my sort of feel, that being on finasteride can reduce a temporary shock loss. What do you feel about that?
It's not something I've particularly noticed. I mean, finasteride in general, I mean, I'll answer a slightly different question, which is I don't, sometimes there's a fear of starting any hair loss medication that can cause shock loss. And I've certainly noticed that with minoxidil, you know, whether you start it as a tablet or topically, or you change the dose, or you go from oral to topical. So anything you change or you stop it, that can trigger a sort of shock loss.
Yeah, but I think it's more common with minoxidil than it is finasteride.
Certainly.
I think finasteride is a bit of a myth that you will always see shedding when starting.
It's not something I've tended to notice in
haven't.
my clinical practice. Nothing compared to minoxidil, certainly. I don't think I've particularly observed an effect of finasteride protecting shock loss or you know, from a transplant, because I don't think you tend to see much shock loss anyway, and it's very hard to have enough data of someone who would start finasteride at the perfect time that would theoretically to prevent them from a shock loss, which virtually never happens. I haven't really seen that.